Hi, my name's Professor Chan Cheah. I'm a haematologist at Sir Charles Gairdner Hospital and Hollywood Private Hospital. As you are no doubt aware, if you live in Western Australia, as of this Friday, masks will no longer be required in public indoor spaces. Now, I think that that's fine if you're otherwise healthy and there's nothing wrong with your immune system. However, if you have a blood cancer, or if someone in your family has a blood cancer, and particularly if you are receiving treatment or if you have received treatment within the last 12 months, I think it remains important to do everything you can to reduce your risk of getting COVID-19. And for the simplest thing that you can do is clearly to continue wearing a mask in spite of it not being mandatory. I'm recommending to all of my patients that despite the lack of a mask wearing mandate, that you should continue to wear your mask in indoor public spaces, particularly if they're crowded or they're poorly ventilated. A lot of the time I'm spending talking to my patients now, a lot of people are concerned about going out and doing things, going to movies, going to restaurants, going to cafes. I think that the new settings that we're seeing in place now will be essentially the new normal, and the number of COVID cases a day, at least in Perth, in Western Australia at the moment, is probably sitting at 7,000 to 8,000. It's probably going to be sitting at that for some time, and at some point everyone will need to make a decision about when they feel comfortable getting back to some semblance of normality. And I think everyone's going to have a difficult decision to make about what level they feel comfortable with starting to go out and about again. But I think that if you've been triple vaccinated and you've had your booster dose, or a second booster dose, in fact, because you can have 5 doses now if you have an active blood cancer, if you wear masks and you use hand sanitizer and you're pretty careful about where you are, I think that that's about as protected as you can be. I think that with Omicron, we have seen that Omicron does tend to cause a milder illness, even in patients with blood cancers. And a number of my patients have had COVID, and fortunately so far, in general, the outcomes have been quite mild. Of course, if you do happen to get COVID and you have blood cancer, please get in touch with your haematologist as soon as you test positive, and test yourself as soon as you have symptoms, because there is increasing access to the oral antivirals, and the main one that we're prescribing at the moment is called Paxlovid or nirmatrelvir with ritonavir, and that will soon be making its way onto the PBS, so it will be easier to access. But the system is set up pretty well at the moment, and we're able to get that into patients pretty quickly. So just to summarise, just mask mandates are stopping, but I think if you have a blood cancer or someone in your household does, keep wearing a mask if you go out. Keep up the hand hygiene, that's really important. Get your booster vaccinations done and your second booster if you're eligible for that. If you test positive for COVID, then please do get in touch with your treating specialist, as we'll be able to access some COVID antiviral drugs for you. Thanks for tuning in.